Do you even know what your pelvic floor is? Hi, and welcome to the Move You channel. My name is Dr. Brittany Ellers. I'm a pelvic floor physical therapist, and I'm here to talk to you today about pelvic floor dysfunction. But first, do you even know what your pelvic floor is? Let's quickly go over that just so that you're aware. If you take your pelvis, flip it over so that you're looking straight down, you've got a couple different bony landmarks here that you want to pay attention to. So everything within this region here is considered your pelvic floor. So all of this musculature, the nerves, the fascia, it's all important for your bowel, your bladder, and your sexual function. So what is dysfunction exactly? If you can't contract, relax, and lengthen your pelvic floor, you might be experiencing some sort of dysfunction, which can look like many different things. First, we're going to be talking about hemorrhoids. So what are hemorrhoids? Hemorrhoids are when you have distended blood vessels in your rectum or around the anus. So they can kind of be classified into two different kinds. So if you want to think of this as your rectum coming down towards your anus, you have a blueberry that is signifying your distended blood vessel or your vein. And an internal hemorrhoid is when that is happening on the inside of your rectum, on the lower portion. And an external one happens on the outside. Sometimes you can see just like a blueberry shape or a color that's dark blue on the outside, but there's skin covering it. And sometimes those internal ones, if you're straining really hard because you can't relax your pelvic floor, that actually might come out of your anus. So a couple different variations of hemorrhoids that can happen. And how do you fix them? Well, there are a few different ways that we talk about in the pelvic floor program, including hypopressive breathing, skin rolling, relaxing your pelvic floor. Those are all very important things to be able to do. So what else can happen? Erectile dysfunction, which is a really unfortunate thing that happens to a lot of men in the United States. It will happen to at least half of men in the United States, so at some point in their life. And that can be the inability to get an erection or to maintain an erection. Maybe it's difficulty with ejaculation, or there's retrograde ejaculation where it comes back down through the penis and through the prostate. So how do you get rid of erectile dysfunction? Well, there are tons of different factors that go along with this. Of course, psychological, maybe there's some other physiological things going on. But from a biomechanical standpoint, you need to have a functioning pelvic floor to be able to squeeze and hold on to the vein that basically keeps the erection hard. Okay. So what are those pelvic floor muscles? They're right here in the front of your body, and if you don't know how to activate that, squeeze that, and maintain endurance, or just find that connection while you're engaged in sexual intercourse, you will definitely want to head to the pelvic floor program to learn about that part of your body. Lastly, we have IBS, which happens to a lot of people, and that's kind of an umbrella statement. So we can think of Crohn's disease, diverticulitis, ulcerative colitis, anything that basically impacts the digestive tract right here, which if you think about your pelvis here, your entire digestive system is sitting right on top of that. So your pelvic floor has a lot to do with controlling it, maintaining that, that stuff that's in there, the fecal matter, the urine, all of it. And so one really important muscle that I like to bring into the discussion is your external anal sphincter, which sits at the very base of your pelvic floor, right around your anus. So you can think of it like a little donut. You do have an internal anal sphincter as well, but if you're unable to feel this pressure control, you're not able to relax, you're not able to hold it, you're not able to squeeze and contract it, then you have an issue. You have pelvic floor dysfunction. And what I really want you to understand is that all of this is treatable. It's all workable. And you know what? We go through a whole 90-day, or you can think about it as a 3-month program in the pelvic floor program, which is in the Move You membership. You can learn how to literally fix your shit, fix your dick and fix your entire pelvic floor so that you can live a full and happy life without having to worry about these issues like hemorrhoids, erectile dysfunction, or IBS. So go and learn about the pelvic floor program today.